Hey, what's up guys? If you're visiting our page, that means you've got some back pain or you know somebody who does, and we have got the answers for you. I'm Dr. Brent Babcock. I'm the owner here at Babcock Chiropractic and Wellness Center. Listen, I know you're tired. We see well over 60, 70 people a day, and I know we hear it all the time that you're tired of getting the medical runaround. You think that the shots aren't really helping and the group therapy sessions, physical therapy sessions don't really do anything, or you gotten to this point where you feel like you just keep getting pushed around. Well, you come to the right place. We get results, and our 5 stars proves it. Listen, we have a 3-step protocol that we implement on every patient every time, and we want you to experience it. And we want you to understand what that 3 steps is now so that you can see what you're getting into. The first step, the secret to helping getting long-lasting results, is you need to mobilize the injured site. Whether you have an acute injury, a chronic injury, intermittent, we don't care. You have to realize that the area that's causing you pain and discomfort is not behaving properly. So the first thing you have to do is you have to remobilize. You have to mobilize that joint so that the IVF or intervertebral foramen, where this little nerve right here, this little peripheral nerve can come out between those joints, can get less irritation. And so once the joint moves, it allows you to get some of that functionality back in your lifestyle. The second step, and has to be done, is we start to realign the spine. You see, mobilizing and realigning are 2 separate steps. And when you begin to mobilize, now you can tell the joint where you want it to sit and how you want it to behave. And once it starts to behave the way it's intended to, you'll start to feel the way you're intended to. This step is usually when most of our patients say, man, Dr. B, whatever you did to me last time, do that again because I had the best night's sleep, or I haven't had pain since our last visit. This is an exciting part of the care, and too often, because it's so exciting, this is usually where a lot of practitioners will cut their patients off and say we're done. When in actuality, we all know that if you've been injured and you've had this injury for a long time, weeks, months, years for many of our patients, then that means that there's probably some musculature that's damaged around the injured site. So it's not all just joint related. So the third step is we actually have to retrain and re-educate the musculature around the injured site. You see, that sense of instability has created a lot of dysfunction in the way that the muscles behave. And so the second that you start getting that mobility and realignment, yes, you start feeling well, but this is the reason why you've been before to a chiropractor or a practitioner of some sort, and you felt good for a month or 2, and then the pain came right back. It's because you didn't follow all 3 steps. When we retrain and re-educate the musculature, we can actually get the muscles to relax so that it doesn't pull you right back out of alignment. Make sense? You see, it's a lot like if you've ever had wet pages in a book. You know what I'm talking about, when the pages get sticky and you can't pull them apart. That's what happens with the viscosity and the inflammation and adhesions that have formed between the different layers of fascia. They don't slide and move like they should. And so whether it's through massage therapy, spinal decompression, ultrasound, stim, physiotherapy, it doesn't matter, but we do a lot of active release techniques on our patients. We have to get the release of that tissue so that way the muscle and the joint work together. That's how we get permanent, lasting results. Now, if this sounds perfect to you, if you're like, oh my gosh, I can't wait to get in, we have made it nearly impossible for anyone to say no. We actually lose money on our first visit because we want you to experience what it's like in our office. We want to let you know that this is something you should have done weeks ago, months ago, years ago for some of you. And so what we're doing is we're giving you the consult, the exam, and also the adjustment, all for $21. That's right, $21, and you get everything. Well, you get to leave our office already experiencing part of that 3-step protocol. And if you wish to continue, then great. We're so excited to be part of your wellness journey. But if this sounds perfect for you, just click below or grab that coupon next to me, and we cannot wait to see you in our office.